4C Home Patient Wet AMD Catch Case, Dr. Miguel Busquets, Retina Associates of Kentucky. On October 22, 2019, the patient was referred for AMD evaluation in both eyes and stated that she was diagnosed with AMD 3 years ago. She complained of mild constant blur due to cataracts for which she plans to have surgery. Vision uncorrected in the right eye was 20/50 - 1, and with correction was 20/30 + 2 in the left eye. Macula and OCT findings showed extensive drusenoid RPE and PEDs OU, essentially flat OD, and suspicious for leak OS. The plan was to refer the patient for 4C Home AMD monitoring program and a cataract surgery consult. She was asked to return to clinic 2 months after cataract removal for exam and OCT in both eyes. Fast forward 2 years later, the patient presents for regularly scheduled dry AMD OU follow-up and was asymptomatic on February 22, 2021. She'd had cataract surgery in both eyes in 2020, and vision uncorrected in the right eye was 2020. The macula and OCT findings showed dry drusenoid changes in the right eye. She was asked to return to clinic in 6 months for a dry AMD follow-up exam and OCT. On November 19, 2019, the patient had established a baseline with 4C Home as seen on the bottom left metamorphopsia map. She continued the monitoring program until alerting on June 13, 2021, as seen on the bottom right metamorphopsia map. The patient presented for examination following a 4C Home alert in the right eye just 5 days later on June 18, 2021, which was 2 months prior to her regularly scheduled exam. She noticed changes in her vision in the right eye, including wavy and multiple lines. Macula and OCT findings showed extensive drusen, PEDs, and new CNV, choroidal neovascularization, with IRF, intraretinal fluid. She was diagnosed with AMD exudative with active CNV OD, and the plan was Lucentis injection. She was asked to return to clinic in 4 weeks for another injection in the right eye and OCT in both eyes, and was instructed to continue 4C Home in the left eye for her dry AMD. Images you see here from baseline on the bottom left metamorphopsia map and the alert on the bottom right metamorphopsia map are from the 4C Home Eye Care Professionals portal. Correlation is demonstrated between the 4C Home alert metamorphopsia map and corresponding OCT images. On September 10, 2021, patient returned for a 4th injection in the right eye. Her vision uncorrected was 20/20 in the right eye. She was maintaining her vision and was, quote, very grateful. OCT findings can be shown here in the images on the right. Her dry intermediate AMD in the left eye was stable, and she was asked to continue monitoring with the 4C Home AMD monitoring program, which is critical for protecting the fellow eye, since studies show a higher risk of conversion to wet AMD. Studies also show that early detection will lead to maintenance of vision long term. Thank you.